Hello everyone, I am Dr. Jyotsana from Chaitanya Dermatology Clinic, Hyderabad. Today I am talking on behalf of DermaVidya and access to dermatology world. Today, as a part of DermaVidya, I am going to discuss about hair fall, its causes, the remedies, and what are the other lifestyle modifications you need to follow to control your hair fall. So, as a hair fall is a multifactorial problem, its reasons are multiple. So, knowing the reason, exact cause of your problem is important before treating a condition. As a patient, whenever a patient approaches to a dermatologist like me, we try to evaluate the exact reason behind that. We try to know the conditions, any stressful event prior to this onset of hair fall, any history of drug intake, any history of health issues, at least a month prior to this issue, any dietary modifications in your lifestyle, and then we examine the scalp to know the local reasons like dandruff or any scalp infection, any fungal infections. So evaluating the reason behind the cause is a first important step for treating a hair fall. So after evaluating the reason, after knowing the reason, the treatment of hair fall again falls into multiple categories. Whether medical management, oral supplementation, or local topical applications like oils and serums, or any other additional treatments. So the commonest reasons for this hair fall are again based on the age. Commonest reasons in a small child is basically due to nutritional deficiencies, and in a teenager it could be because of dietary modifications, stress, as well as a dandruff. Similarly, in a 40 to 50 years age group, it could be because of other health issues or a polypharmacy because of the multiple medications they are on. And similarly, in geriatric age group, it could be because of absorption issues with the diet or because of other health issues like diabetes, thyroid, and multiple other factors. Apart from this, the commonest reason in Indian females particularly is iron deficiency and hormonal issues. The current issue mostly in our teenage population is hormonal issues. A lot of teenage people are suffering with PCOD and hormonal issues. This also can lead to hair fall. So hair fall is into of two types, whether it's actually a loss of hair or thinning of hair. So loss of hair is because of acute issues like deficiencies, and where people will be complaining like, doctor, I have lost the hair, I'm losing daily hair in bunches, or I'm losing the hair when I wash my hair. So this is one set of category, we call it as a telogen effluvium. Similarly, there is one more thing where the patient complained, doctor, recently my hair is thinning out a lot. I'm able to see the skin through my hair. I'm able to see the receding of my hairline. So these are called as a patterned hair losses, which are mostly influenced by genetics and hormonal issues. So the treatment varies based on your type, whether the hair fall is because of your nutritional deficiency like vitamin D deficiency, iron deficiency, or B12 deficiency, where we advise both a medical management as well as supplementation in your diet. So we always a diet chart also varies based on your reasons behind your hair fall. It's not a common diet for everyone. And similarly, if it is a hormonal issue, probably a lifestyle modifications like increase in your exercise, losing weight, and leading a stress-free life. All these are important to treat a hormonal related hair loss apart from the medical management. Along with these things, other issues like post-pregnancy or post-delivery hair loss and stress-related hair losses are dealt in a different manner. So we have, while treating the patient, we have multiple options like oral supplementation. So oral supplementation, we try to correct the iron deficiency, B12 deficiency, D3 deficiency. But prior to that, it's always important to follow a balanced diet, because deficiencies are corrected for a limited period, but balanced diet helps us in a long-term maintenance of hair fall control, a stress-free life, a proper sleep cycle in your day-to-day activity is definitely going to help your hair fall control. Maintaining your scalp cleanliness, where you take a regular, more frequent head washes. If you have a mild dandruff, try to include an anti-dandruff shampoo. So all these measures, and if you are having habits like smoking and frequent drinking, a control of these lifestyle habits, definitely they are going to decrease the blood supply to your scalp and impair the hair regrowth also. So all this will help in not only controlling the hair fall but also in regrowing the hair. But if your problem is hair thinning, like pattern baldness, as we have discussed, we have hair regrowth supplements, like where we have certain protein based or peptide based hair serums, minoxidil based hair serums available for topical application, which increase the hair thickness and new hair regrowth also. So apart from these things, if patients still have a poor response, nowadays we have multiple therapeutic options like platelet-rich plasma therapy or a growth factor therapy, or at the last, if still the pattern hair loss regrowth is not there, the last option we still have is a hair transplantation. So a hair treatment is not just a problem which can be solved with one hair oil which is just advertised. It has to be evaluated scientifically, thoroughly by a dermatologist and treated accordingly. So whenever you are suffering with hair fall, and if you feel it is not coming under control, please don't hesitate to consult a dermatologist nearby to you and get it evaluated thoroughly and get it treated. Thank you. Hope you like this video on hair fall, the reasons behind hair fall, the remedies and oral supplementation. If you like this video and want to check out more such videos, please check out the website DermaVidya.com. As a dermatologist, my recommendation is for any skin or hair related issues, please do not self-medicate or buy or use online products. Please consult a dermatologist nearby before going for this treatment.
For more such videos, visit or log into DermaVidya.com.